Liposuction is the process which removes fat from certain body areas. This process of liposuction is becoming hugely popular nowadays because people are becoming more and more conscious about their appearance and body image. For them, having some extra amount of fat on certain body areas is completely no. But does everyone get good result or satisfactory result after liposuction? No. So, in this video, let's see how you can get a desired outcome and optimal result from your liposuction surgery. Hello, I am Dr. Ashish Sangvikar. I am a board certified plastic cosmetic surgeon and I practice at Mumbai and Navi Mumbai. I am the director of Restore Aesthetic Clinic, Navi Mumbai. On our YouTube channel, we have a lot of videos about different cosmetic surgeries and non-surgical procedures. If you are thinking of any such surgical or non-surgical cosmetic procedures, you can watch our videos. That's how you will get a lot of information about this procedure so that you can take a well-informed decision. We are going to bring many more videos on the topic of liposuction. So, if you want to watch these future videos, please press the bell icon so you will get the intimation of our future videos, and don't forget to like this video. If you feel these videos are informative and some of your friends might get benefited, please share this video with your friends and colleagues. If you are thinking of liposuction, then the first and foremost thing you have to decide is whether you are a good candidate for liposuction or not. It depends upon your expectation for what purpose you are going for liposuction. If you think liposuction is a weight loss surgery and you are going to quickly lose 15-20 kgs with liposuction, then sorry, this is not going to happen. Liposuction is a body contouring procedure. It is not a weight loss procedure. The weight loss after liposuction is moderate. It won't be very magical or significant like 15-20 kgs. Yes, some amount of weight loss does happen after liposuction, but it will be moderate. So, if you are considering liposuction for weight loss, then you are not a good candidate. Then who are the good candidates for liposuction? The good candidates for liposuction are the ones who have 15 to 20% more weight than their ideal body weight. They are not very obese. They are not say more than 100 or 110 kgs. The people who have maintained their weight over last few months with healthy lifestyle, and people who are otherwise healthy with no or minimal risk factors. If you are obese, your weight is more than the ideal weight which can be reduced with liposuction, then what you are supposed to do? Then you should reduce your weight with diet and exercise, bring it down to the level after which liposuction can take care of it. If you are grossly obese, more than 110-120 kgs, then one more option is bariatric surgery. I am not expert in bariatric surgery, but it is always worthwhile to take opinion from a bariatric surgeon. Grossly obese people have got problems because of their weight, like knee pain, uncontrolled diabetes and others. So, their primary aim is weight loss rather than body contouring. And as I said, liposuction is a body contouring procedure. So, if your weight is more, do diet and exercise, bring your weight normal level or few kilos more than your ideal body weight, then you think of undergoing liposuction, because then the liposuction can remove the stubborn fat, the fat which you could not lose with diet and exercise. That stubborn fat can be removed with liposuction. By this way you can have double benefit, that you have lost the weight and the stubborn fat which you could not lose with diet and exercise is removed with liposuction. In the second criteria, that is your weight should be maintained. Liposuction is a surgical procedure and you cannot do it again and again. So, if you put on weight after liposuction, the all good results of surgery will be lost. So, you must try to maintain your weight with diet and exercise for few months. When you are confident that you can maintain the weight and you can maintain the same healthy lifestyle after liposuction and maintain the result of liposuction, then you should undergo the liposuction procedure. I always advise my patient that you should be able to maintain your weight at least for 3-4 months before undergoing liposuction. Third criteria, the otherwise healthy patient. That means you should not have any major risk factors. So if you have diabetes, the diabetes should be under control. If you are hypertension or high blood pressure, then you should take medicine, bring your blood pressure to normal. If you are taking any blood thinners, any herbal medicines, all these medicines should be stopped at least 2 weeks prior to the liposuction. Smoking, I always advise patient to completely quit smoking, but if it is not possible, you should quit smoking at least 2 weeks prior and 2 weeks after the procedure of liposuction, because smokers have got increased chances of all complications like wound healing, swelling and everything. So it is advisable to stop it at least 2 weeks prior to the surgery. Then next comes selection of this proper surgeon. As I always say, if you think of cardiac surgeon for your heart surgery, think of cancer surgeon for cancer, then you must think of a board certified plastic cosmetic surgeon for your liposuction procedure, because only plastic surgeons are trained and have expertise to do the liposuction and to tackle all the after effects after the liposuction. Once you have selected the surgeon, you must meet him personally, discuss your expectations, discuss all possible consequences and complications of the procedure, and then take the decision. Expert plastic surgeon will also guide you whether you are going to require only liposuction or some other procedure in combination with liposuction. Like if somebody is having excessive stretched out skin hanging around the waistline, they require tummy tuck. A loose skin over thigh will require thigh tuck along with thigh liposuction. A loose skin over arm will require arm tuck along with the arm liposuction. So only an expert plastic surgeon can guide you whether you are a good candidate for only liposuction or liposuction with other body contouring procedure. That's why it is very important to select a proper experienced board certified plastic surgeon. After liposuction, precautions and care is also important to get a good outcome of your liposuction surgery. Follow all the instructions of your operating surgeon. Take all medicines on time. This will hasten your recovery. Take adequate rest. Don't be in a hurry to join back your work or your stressful life activities. But that doesn't mean you should be confined to the bed all the time. I always encourage early mobilization of the patient. If only liposuction is done, I always tell patient that they can start moving in a hospital room or at home if they are discharged from the same evening or at least from the next day. You can start your day-to-day self-care activities in a day or two. About the pressure garment is the most important thing to get good result of liposuction. Wear your pressure garment as per instruction of the surgeon in immediate post-operative or post-procedure period. It will prevent the accumulation of body fluid and hematoma under the skin, that is in areas of liposuction. In delayed recovery period, it will limit the amount of swelling which will come over the operated area. In long term, it will help in skin contraction and redraping of the skin along the new contours of the liposuction area. That's how it will prevent the lax skin and skin creases and folds. To maintain the result of liposuction, you must inculcate all good or healthy habits. Eat healthy food, do regular exercise, try to maintain your weight. I always tell my patients, you have taken a great efforts, great trouble in undergoing liposuction. Don't lose the result of liposuction. Maintain the healthy habits and maintain the liposuction result for a longer time. Thank you.